Good morning, everyone. Welcome to the final talk in our new diagnosis workshop series. Today, we have Neuro Physiotherapist Michelle McCarthy speaking on living well with Parkinson's through exercise. Following her talk, Dr. Jonathan Squires and nurse practitioner Joanna Davis will be joining her on our 30-minute panel Q&A, whereby all three can answer your questions in their area of expertise. My name is Alana Dillon. I'm an Education and Support Services Coordinator at Parkinson Society BC and will be facilitating the webinar today. Before I introduce Michelle McCarthy, I'd like to go through a few housekeeping items. First, I want to let you know that we are recording this webinar and it, along with the presentation slides, will be available on our website. Secondly, you will see a chat icon at the bottom of your screen. You may click on that to open it up and feel free to use this chat box during the webinar to make any comments or questions on today's presentation topic. And finally, to optimize your experience with this webinar, please ensure that you adjust your speaker volume both on your computer as well as on your actual speaker so that you can hear the webinar well. It's my pleasure to now introduce neurophysiotherapist Michelle McCarthy. Michelle graduated from the University of Southampton, UK in 1997 with a Bachelor of Science Honours in Physiotherapy. She began her career in two large teaching hospitals in London, UK, and after a couple of years specialized in the area of neurological physiotherapy. Michelle has continued to work with clients with neurological conditions across the continuum of care, including Parkinson's disease. Since moving to Canada in 2007, Michelle worked in acute care and neurosciences. Currently, as an integral member of the Pacific Parkinson's Research Center Movement Disorders Clinic team at UBC, she helps Parkinson's patients manage the physical challenges of Parkinson's disease from early diagnosis onwards. Throughout her career, Michelle has taken on leadership and educator roles and strives to develop new initiatives to provide the best possible care for clients, empowering them to effectively heal. Michelle, welcome. Thank you so much for joining us this morning, and I'll pass it over to you now.
Thank you so much, Alana, and good morning to everyone. First of all, before we start, I would just like to acknowledge that I am speaking from the unceded territories of the First Nations people, including the Musqueam, Squamish and Tsleil-Waututh, and for that I am truly grateful. And so here we are. It's a little bit strange. I can't see everyone, but hopefully you're all doing well and enjoying this beautiful sunshine. I am going to be speaking today about exercise and Parkinson's disease. And normally, if we were together in person, we would start off with a little bit of movement. Now, obviously, we're all in our own homes, and that's a little bit tricky. I can't see any of you, but if you do need to sort of get up, move around, please feel free to do that. Have a little bit of a stretch. It's important that we aren't sitting all of this time there. So, okay. Sorry, okay. So what we're going to look at is really talking about how important exercise is. And really it should be viewed sort of alongside with your medications. Like doctors will write a prescription for medications, that exercise should be sort of part of that and sort of treated as so. So when we're thinking about exercise, we want to think about why we want to exercise, when we want to do it, what we want to do, how we're going to sort of achieve the exercise we want to do, and then where are we going to do it. So when we're looking at the benefits of exercise in Parkinson's, I mean, I think we all know that exercise in general is really important for all of us as human beings. We need to keep moving, we need to use our muscles. but certainly it has been shown to improve physical fitness, strength and endurance. It can improve functional tasks. And this is really important with helping to manage symptoms of Parkinson's and the functional impact that they can have. So things such as improving gait speed, being able to move in bed, being able to get in and out of a car, all of those movements and those muscle activities are really key to work on. So exercise can also help to improve postural stability and core muscle control, improving balance and coordination, reducing stiffness and therefore increasing our range of motion and our flexibility in our muscles. And it can also help to reduce fatigue. So often when we're tired, we fall into a trap of just taking a rest. But by actually resting too much and becoming more inactive over a longer period of time, it can then take more energy to activate our muscles. It's we lose the fuel in our gas tank, if you like. So we need a certain level of energy, exercise, and activity to maintain those energy levels and use our muscles in the most efficient way. So exercise can also help to reduce the risk of falls. It can improve mood, promote bone health, particularly with weight-bearing exercise, can assist with bladder and bowel management, and it can influence brain plasticity, neuroplasticity, maximizing all of those areas of our brain to that we use to get the most efficient movement. And the research has also shown that particularly for Parkinson's, that it can have a neuroprotective effect, and it may in fact help to slow disease progression. So when do we start? Well, the answer is right now. And if, as I say, we were together, we'd be doing some movements and getting our bodies moving together. I think we can all attest to the fact that we have good intentions. If you're an avid exerciser, that's fantastic. If you're not, it can be hard to start. It can be hard to find that motivation sometimes. Or you think, oh, I'll start tomorrow. I'll set a goal, I'm going to start next week. But really, ultimately, we just keep putting it off, and we just need to start right now. So when we're looking at how much, what we should be doing for exercise and how much we should be exercising, there are some general guidelines through the Canadian Physical Activity Guidelines, which looks at different age ranges. And I've got both here. I will go to the other ones as well. And there's not much difference, but really what we should be aiming for is at least 150 minutes of moderate to vigorous intensity aerobic exercise, and then muscle strengthening activities of major muscle groups at least 2 days a week. Now, that doesn't have to be all in one go. You can split it up into different segments, and 10 minutes or so. You can maybe do half an hour. And a moderate to vigorous intensity is where you want to feel as though you're exercising, feel as though you're working, but not that you're so out of breath that you can't talk. So you definitely want to still be able to to speak a sentence, or to have a very short conversation there. As well as the Canadian physical activity guidelines, they then further developed that into looking at a 24-hour period, because we don't want to just exercise or move for 10 or 30 minutes during the day and then do nothing but sit down the rest of the day. So it's really also addressing the importance of sleep, and also reducing our sedentary behaviors. I think we've become much more tech savvy over the last number of years, and there's a lot we may be looking at on the internet or on email, or sort of podcasts, different things like that. And so as well as having the physical activity of sort of the 150 minutes and the other sort of activities twice a week, getting sleep for 7 to 9 hours, but also limiting our sedentary behavior. So it doesn't mean that you do half an hour of exercise and then sit for sort of 10 hours sort of watching TV. You need to sort of be breaking that up and still be sort of having some light physical activity, sort of standing, moving around the home as you're able to, and to really not sit for any longer than 3 hours, sort of having sort of no more than 3 hours of screen time sort of in a day if possible. And you want to break that up. So you want to make sure that, again, you're not sitting there for lengths of time. So then sort of looking at the physical activity guidelines for those 65 years and older, where this is slightly different is that it then highlights the importance of activities to enhance balance and preventing falls. Now, I would actually argue that sort of that's important sort of under 65 as well. I think it's important for any of us to be sort of continuously working on our balance and activity. It's certainly something you don't want to do anything about, and then suddenly when you hit a certain age you think, oh, I've got to work on this. It's really important to be incorporating into your plan. Okay, and again, sort of with the 24-hour guidelines there, it just includes the sort of the balance for that, and a slightly different sort of time on sleep, so 7 to 8 hours compared to 7 to 9, but still the same message around not having too much screen time, breaking sort of longer periods of sitting up. So some resources that are really useful for sort of helping us sort of set goals, get on track, sort of making a plan. One of these is the Parkinson's Calendar Physical Activity sort of brochure. So it's again looking at sort of why you want to do these activities, some different examples of activities that you can do. Okay. And then sort of setting out a plan and sort of, you know, day by day. Now, everyone will work differently as to sort of how they manage that, whether you set reminders in a calendar, whether you have it visual, whether you have alerts on a smartphone. We're going to come into sort of some different examples of exercise and things that you can do. And so that may affect sort of how you plan that into your day, how you schedule that. Okay, sorry. Another excellent resource is from the Parkinson Society of BC. So this is an exercise booklet that was recently produced by the Neuro Physio Shelley Yu. And again, it goes through some really key areas around sort of the benefits of exercise, types of exercise, balance, and actually includes a number of exercises in that. So that is available as a PDF through the Parkinson Society of BC website, and I would encourage you all to take a look at that. As I say, Shelley has put that together, and it's an excellent resource. So options for exercise. People will often come to me and say, what is the exercise that we should be doing? And ultimately, it's really something that you enjoy. For exercise to be successful, you really need to have consistency. It is important what you do, but more important is around the consistency and sort of continuing it. It's not a case of maybe in the past where you've had an injury to part of your body and you've maybe seen someone, you've gone through some exercises, and once that's got better, you then kind of stop doing those exercises because it feels better. Unfortunately, that's not quite the case here, and this is sort of a lifetime commitment now to sort of continuing with exercise. And so to be able to sort of achieve that, you really need to enjoy it. And everyone has different things that they enjoy, and it's really being true to yourself and understanding what you enjoy. and acknowledging that. Don't go by sort of because someone told you had to do something that you go and do it. Now, it may be that you want to try it and then you come to really enjoy it, and you're able to continue it. But certainly, for example, if someone told you that you had to go swim, but you really don't like getting in water and going to the swimming pools, then that's not something. You may try it once or twice, but it's not something you're going to sort of continue on a long-term basis. So when we're looking at sort of the options, you really want to sort of include sort of a multitude of areas. Now, the guidelines sort of focus on the aerobic and the strengthening side of things, and then the balance for the older adult. But it's really looking at this sort of cycle of aerobic activity, strengthening, balance, postural muscle control, and flexibility. And also within this, it's sort of not part of my diagram, but sort of looking at the cognitive aspect, the sort of the multitasking aspect that you can bring into exercise as well. So here are some examples of things that have, some of them being designed specifically for people with Parkinson's. So we have the Parkinson's Wellness Recovery, that is really focusing on functional movements and making them as big as you can. I really like these exercises for incorporating all of your body in the activity and the exercise. And it's Dr. Becky Farley down in the States who has sort of developed these. They're online, you can sort of access those. There are different classes out in the community. Well, pre-pandemic at the moment, things may be online, and hopefully we'll get back to in-person activities more and more over the coming sort of year. We've got rock steady boxing. Boxing has been shown to be sort of a great activity for sort of looking at sort of big movements and sort of really accessing rotation as a movement, which is really important for people with Parkinson's. Tai Chi, sort of meditation, looking at those sort of aspects of sort of balance and control. PD Warrior is something that has stemmed out of Australia. And again, it's looking at some of those sort of bigger movements that's sort of based more on a circuit of activities. And I think there are sort of a small number of people sort of here that do have that training as well. You've got dance for PD if you're not a gym person, if you prefer to sort of move in a different way. There are definitely classes there. LSVT Big, again, is looking at big movements, and it was sort of along similar lines of the Parkinson's Wellness Recovery as sort of all body big movements. You may get out in nature, go out for walks, a great social activity, great to be outside and sort of have that other side of wellness sort of from being out in nature and fresh air. Or you may like the pool, you may have some other sort of health conditions, which mean that actually sort of for your joint protection, it may be easier for you to be in water, either walking or swimming or sort of exercises there. And you may be into sports. I have lots of clients that like to golf. I have lots of clients that have picked up pickleball, which is what this is. And it's definitely something that I've wanted to try and see. But whatever it is, it may be something that you've previously done and you're sort of continuing, or it may be something that you're new to, that you're just sort of picking up and trying out. A lot of people will cycle, and sort of I have clients that will use sort of a regular bike or maybe a sort of a tricycle. We've got the e-bikes out there now, which can help you get up some of those tough hills. So when we're sort of having our considerations for exercise, we really need to think about, are you already exercising, but maybe need to consider a different type of exercise? So maybe sort of if we think back to that sort of circle of activities, that maybe your exercise so far has been sort of very focused on aerobic activity and you've not really considered the other aspects. So you may be sort of bringing some things in to just complement the things you're already doing. We have to consider, are you new to exercise or have any other health conditions that you may need to consider? And that's definitely a conversation you want to have with your doctor. You can complete the PARQ questionnaire, and I've got an image of that in a minute, which sort of identifies your physical readiness to exercise. And then if you do have other health concerns, you may need to consult with your doctor and get their agreement for certain activities or certain exercises, and they may need to complete the ePARMEDX form. And some classes, some groups may ask you to complete these. You want to consider sort of the frequency, intensity, the timing, and type of exercise that you want to do. So frequency, it really depends on your lifestyle, whether you're working, whether you're not working, whether you have family commitments. But sort of if we think back to that, we need to sort of have 150 minutes and sort of our strengthening exercises as well as with some other things, that we're probably looking at sort of trying to do something each day, or at least sort of 5 days out of the week. When we're thinking about intensity, there's research has shown that sort of the more sort of effective exercise tends to be a little bit of a higher intensity. Now, that doesn't mean that sort of a low intensity exercise isn't helpful, isn't beneficial. That's just something that they have studied in some of the research, and intensity is going to be different. So it's your individual intensity as to sort of what is that moderate to vigorous sort of activity for you, and that's where you're sort of you're wanting to work to a point where you're feeling like you're working, you're exercising. It's a little bit hard, but you're still able to sort of be able to talk. You don't want to be over exerting yourself that you're not able to sort of catch your breath or talk at all. Timing, for some people, if you're taking medications, you may want to sort of time it when you're sort of feeling sort of your best in the day. For other people, it may be sort of more of those other commitments that influence the time that you do. If you're new to exercise, you definitely want to pace yourself and build up gradually. If you're used to exercising, it may be that you've got to sort of change things a little bit, maybe modify sort of what you have been able to do and what you're able to continue with. The exercise should definitely challenge you both physically and cognitively, and you'll find sort of potentially classes out there that will add sort of cognitive components to a physical task, and they may do things such as while you're physically moving, that you have to name countries through the alphabet, or or give you sort of different sequences that you have to follow sort of with colors and numbers, and definitely sort of adding that cognitive component is helpful in that multitasking. So for individuals, you want to look at sort of whether you prefer doing something at home, whether you're out in the community. Now, obviously with the pandemic, we've all been a little bit limited as to sort of what we've been able to do out in the community. But again, hopefully that will be sort of improving. And whether you prefer to do something by yourself or whether you're more of a group person. I know certainly for me to be accountable, I'm much better if I'm part of a group rather than left to my own sort of devices. You really want to try and incorporate it into daily routines. So if you do work with a physio and they've given you exercises, it may be that you can incorporate sort of certain ones at certain points of the day. You might not do all of the routine in one go, and that's okay to split things up and put things sort of to make it sort of most effective for you. That's going to sort of increase that ability for you to be consistent and continue with it on a regular basis. You want to sort of set yourself some goals. We want to sort of, maybe you want to be able to sort of get out and do something with a friend or a family member. Maybe you want to be able to walk a certain distance or do a certain activity. Really thinking about those goals as to sort of what you want to achieve by doing this activity and exercise. Many people now have technology to track their progress. I often get informed about number of steps people are doing in a day. Sort of we have watches or phones or things that are tracking us, and sort of having that idea. And that's great to sort of see, there may be sort of days where you haven't been as active, and then you look at that tracker, and sort of it really sort of may nudge you to be like, okay, I haven't moved so much today. I need to get up and I need to sort of maybe go for sort of a brisk walk for 10 minutes, or I need to do some of my exercises. And for some people, technology isn't their their thing, so they may sort of have more of a visual tracker. You may have a calendar on your fridge, sort of as a visual way to sort of just track how you're doing and how you're progressing there. We all know that it's not always smooth sailing, and sort of we want to sort of really plan for those sort of bumps in the road, and to sort of have a backup plan for the off days where you're maybe not feeling so good. So it may be that instead of sort of doing all of the exercise you planned, or instead of going for the long walk that you'd intended to go for, maybe there's a shorter walk you can do, or maybe there's a sort of, you can do a small number of the exercises, but still trying to do something, even if it's not sort of the whole plan that you had. Definitely looking to seek support from your family, friends, professionals. Sort of really, again, I find that when people have that accountability, sort of they're more likely to sort of stick with the plans and sort of achieve their goals. You want to make sure whatever you're doing is safe, particularly if you do have any difficulties with balance. You want to make sure that you are sort of participating in things that are safe for you to do so. And then most importantly, you just really want to have fun. And that's probably the key there. So this is the ParQ Plus that you can do it. There's actually a fillable form online, or you can get the PDF version. And it's just identifying if you sort of have any other medical conditions and things you might need to consider before starting exercise. And that's something, again, you can discuss with your doctor if you have other health conditions or concerns. So looking at community resources. So I think the Parkinson Society of BC has some amazing resources available over the last couple of years of the pandemic. They've made so much available online, and sort of continue to have sort of regular events and regular activities, which I have many clients that sort of participate in and really enjoy them. As I say, Shelley Yu is the neuro physio working with the Parkinson Society of BC, and she, over the course of the pandemic, has sort of led a number of different exercise classes, and those have been recorded and archived on the website, so you can access those videos to follow along with. And sometimes that's easier to sort of follow along with something rather than looking at a piece of paper. But I definitely encourage you to look at those and join in with some of those. We also have the BC Brain Wellness Program, which is a program that has stemmed out of our Centre for Brain Health with one of our neurologists. And this is looking at brain wellness as a whole. So it has an exercise component. And the physio sort of leading that is Sally Stelling. You have an assessment, and then that can help determine which classes may be the best option for you. At the moment, these are all online. Again, this is a free program, but as well as exercise, they also have other activities. They have sort of dance, they have yoga, they have mindfulness, they have art, they have gardening, they have a book club. So looking at brain wellness sort of from other aspects other than exercise. So NeuroFit BC is one of our private neurophysio. Naomi Casero, her clinic. She now has a couple of locations, one in Vancouver, one in Victoria. And she is extremely passionate for clients with Parkinson's, and that's sort of the main focus of her her clinic, her practice, and she has made available a number of exercise videos online that again can be accessed for free. Her classes are fee-based, but her videos are accessible for free. Impact Parkinsons is a community that unfortunately due to the pandemic had to shut their actual location, but are still providing services online. And then the Parkinson's Wellness Project is based in Victoria. You may want to connect with a physio, have an assessment. If you're part of our clinic here, you can access me. If you're in another community, you can connect with your local physio. If you really have difficulty connecting, again, Shelley through the Parkinson Society of BC, they have a program where they will consult for people that are unable to sort of connect with any other sort of therapist locally. To find a physio, we have a BC physio organisation, which is here, bcphysio.org. There's a little green button when you go on that to find a physio, and then you can put your search criteria. So you can put your location, and under the area of practice, I would encourage you to put neurology, and then that will bring up physiotherapists who have experience of people working with people with neurological conditions. And then if people have had further training, you'll often see that they may be the PWR certified or LSVT, and sort of they'll often sort of identify that for you. So sort of again, sort of pre-pandemic, there were many community center programs, and some of those did transition online. Some of them may be getting back to in-person. So it's really looking at your local community centers, seeing what's available, seeing what classes are there, whether that be sort of PD specific, whether it's sort of a class sort of focusing on balance or a Tai Chi or yoga. It's sort of good to sort of look out and see what's there in your community. Choose to Move is a sort of a free sort of 6-month approach, and it's a little bit like a coaching. So sort of you're linked with someone who will then connect with you and help you to set goals and really help you to be sort of accountable and sort of working towards those goals with a physical activity plan. And then the HealthLink BC also has, you can call 811 and be connected with a qualified exercise professional there. Okay, so now we're going to move on to living well with Parkinson's. And here, so we have life is like riding a bicycle. To keep your balance, you must keep moving. And that really is sort of the key. We've got to keep movement. We've got to keep active there. So the importance sort of for thinking about sort of, you know, not only exercise as sort of, you know, a factor is, but sort of looking at sort of how we can sort of live well and sort of whole brain wellness, if you like, and that's sort of having your connection with others. So be that with friends or family members, be that with sort of healthcare professionals, support groups. It's sort of really trying to find the connections that work for you. You want to sort of look at sort of any potential lifestyle modifications and instilling some healthy habits. So sort of be that around sort of your sort of diet or any sort of other sort of habits that you may have that may not be considered as sort of as healthy. So you want to be kind to yourself as well, sort of engage in relaxation therapies. And that's where people may engage in things like the mindfulness practices, breathing techniques, and sort of really trying to sort of instill that as part of your activity program as well, sort of that, you know, maybe even at the end of your exercise, you can take a moment just to do a little relaxation, a little sort of breathing there before sort of moving on with your day. We've definitely talked about staying active. and sort of key areas sort of around there. And then also looking to sort of build your care team. So, and we've got a little sort of slide coming up for that, and really informing yourself. Now you're all here today to sort of, and over the last couple of sessions to really get information and sort of to educate and be informed, and that's sort of fantastic. So it's really looking at sort of, building your team, and the team can look sort of, very different for different people. And so it may be that with you as the center, that first of all, you'll have family and friends, you'll have your care partners, your spouses. So you've then got sort of the medical professionals. So you may have your GP, you may have a neurologist, a movement disorder specialist, your nurse practitioner, your nursing team, your physio, occupational therapist, a social worker, speech and language therapist, psychiatrist. And then outside of that, you may have sort of your society, so the Parkinson Society of BC, Parkinsons Canada, your support groups. There may be other sort of personnel, such as a personal trainer that you work with, or sort of your other sort of classes and sort of counselors, therapists sort of work in there. So here, so it's looking at all of the aspects of living well, and as well as sort of being active, it's addressing any areas that you may have concerns. So it may be that you want to speak with a social worker about work, or occupational therapy about work, or functional activities. It may be that your voice has changed slightly and you want to connect with a speech and language therapist, that you want to sort of discuss diet with someone, sort of really making sure that we're getting a good amount of rest and sleep, so that you can be active in the day. And then looking at sort of stress reduction and mindfulness, and sort of helping to manage any sort of stress or anxiety that you may experience. So we're going to be finishing a little early. I'm sorry if I've talked really fast. So some key messages is really that sort of Parkinson's disease progresses slowly. Sort of exercise and medications can help to control symptoms very well. You don't have to go through it alone. So create your team. That's really important. And that you want to focus on living sort of the best life you can, be positive and proactive. Someone else isn't going to do it for you. So you sort of need to sort of engage and set goals and see what you want to do. And then also sort of, there are advanced therapies that do exist, and sort of there's always research being done. And so sort of just coming towards the end is that you don't want to believe everything you read on the internet just because there's a photo with a quote next to it. And this is really important. I think we have easy access now to lots of different information, but it's really checking that the information you're reading is accurate. And so sort of looking at reliable resources, looking at the societies, the foundations, speaking with your medical professionals, your doctor, to really get that information. And so we have questions. So I have finished a little bit early. I'm going to stop sharing my screen.
So Michelle, our Q&A starts in about 10 minutes, but yeah, I think we'll probably start with these questions that are directed to you, and then yes, Jonathan and Joanna will join us. So I'll let you read the questions from the chat box. There was somebody that had their hand up. I don't see it now, but if you had a question and you meant to raise your hand, please do raise it again. We can answer questions through that function as well.
Okay, so I'm going to just scroll down. I've pulled up the chat. I'm going to scroll down. So finding a physio with Parkinson's. So yes, so I think I mentioned the bcphysio.org website, and there's a find a physio option there. You can bring it down to neurological physios, and then it would need a little bit of reading around their bios and resources as to sort of if they've had a lot of experience of working with people with Parkinson's. And if you really truly don't have anyone in your community that you can connect with, then as I say, there is that sort of service now through the Parkinson Society of BC with Shelley there, that they are providing a if you meet the criteria, that you could potentially connect with her. So then we've got, I've been physically active most of my life. Okay, so I think this comment is around sort of previously being very active. With the pandemic, it's been more virtual activities. And now in the garden, and sort of moving around the garden, and can spend hours sort of cutting and moving around. So family is cautioning how much you do, and particularly when you're stiff and sore the next day. So I think really sort of individuals, you are an expert in your own bodies. You know how it feels. So when we exercise and if we're doing something new, something different, it is normal to feel sort of a little bit sore, stiff, achy, sort of the next day, maybe a couple of days. What you don't want to be doing is kind of pushing yourself to a point where you're maybe not able to do anything at all for the rest of the day, or that it puts you out for a number of days after you've done the activity. But I think as long as sort of you feel safe and sort of enjoying what you're doing, and again, it's those practical, those functional activities which are still giving you that physical movement and physical activity. It may not be sort of a traditional exercise, but it's definitely activity in your body, and so I think as long as it's the stiffness and soreness isn't lasting for a prolonged period of time, then I think that's good. Okay, so the next question is that there seems to be a set approach to physio for Parkinson's. How do I make sure that my specific physical challenges are voiced and effectively addressed by my physio? So, and we just had Joanna joining us. Joanna, I just finished a bit early, so I just finished a bit early, Joanna, so I'm just answering some of the physio questions. So I think when you connect with your physio, you should have an individual assessment, and so they'll be able to identify if there's particular areas of your body that you need to work on. I mean, yes, there's a sort of a general sort of range of activities that you want to be doing, and sort of particularly with sort of Parkinson's, is being very mindful of posture. Rotation is a really key area, extension there. But I think it's really having that conversation, and it may be that sort of with the physio, there may be some sort of specific exercises that you could add into that program. Yeah, and then at what point do you contact a speech pathologist? I think when you're if you're having any challenges, I think it's always good to get in to see someone early and have guidance and guidelines an assessment and things to work on. Definitely exercises, voice exercises can be started early there. So yes, you can definitely connect at any point. Okay, so attended a Zoom class, episodes of dizziness when in class, feels like the body is overheating. So you opened a window, sat down. I think it's really important to make sure that that first of all, there isn't anything else medically that could be causing the dizziness, but also that you're staying hydrated. So yes, I think being in a cool environment, it may be that if you want to continue with the Zoom exercise class, but it may be that you might not be able to complete all of the repetitions. You may need to take a little bit of a break before you get to that point of feeling like you're overheating, and taking frequent water breaks. So just making sure you keep hydrated. So any tips on improving sore joints? Exercise a lot and sometimes limited by hip and shoulder mobility. So I think that's it's a little tricky to sort of answer sort of specifically individually. It may be making sure that sort of you're warming the area up and then also cooling down after exercise. If you've got sort of particular limitations in certain sort of movements, it may be that you want to stretch into that area, but I would really sort of suggest that you have someone look at that with you. And that, it may be sort of depending on the type of exercise you're doing that you then want to consider sort of an alternative there. I have poor sleeping habits. Living on my own makes it somewhat difficult to stay positive. So I don't know if anyone else has, I know Jonathan has joined, Dr. Squires has joined us, and we have Joanna on. If anyone would like to jump in, I started my questions early because I finished early. If anyone has anything to add about sleeping habits, I think, I think one of the key things that I've learned is sort of trying to have that consistency, so that consistent sort of bedtime and wake up time, and not having screen time before going to bed. And I understand sort of when you're on your own and sort of, it can be sort of tricky, and so it's finding other ways to have those connections with people, whether it's through a support group, whether it's through friends, whether it's through a professional, and maybe sort of one of those sort of coaching, sort of either the Health Link or the Choose to Move, depending on your age, maybe sort of something that you can connect with as well. I don't know if either of you have anything to add about sleep.
Sorry, I was getting water. I missed the question.
So I'm just reading from the chat. So they've just said that they have very poor sleeping habits, and living on their own makes it somewhat difficult to stay positive.
Okay. Yeah, so we talked a little bit about sleep last week. And as Michelle mentioned, sleep hygiene, what we talk about is really important. So like keeping the bedroom dark and, having that routine before bed, doing something relaxing before bed, whether it's having a bath or a shower or, reading a book, trying to avoid screens right before bed, certainly not having any electronics in the bedroom. And then, try to get into that relaxed state and then hopefully you can fall asleep. And then if you can't fall asleep within kind of 15 minutes or so, then we kind of recommend getting up out of the bedroom, going to another dimly lit room, doing something boring like reading a magazine, trying to do that deep breathing again, and then going back to the bed, so that you're kind of creating that positive association between your bed and a place where you sleep, as opposed to a place where you just lay and, stare at the ceiling, which can just further cause more problems, I guess, with your sleep.
And then the next question is, when should we see a movement disorder specialist?
I guess I can take that one.
Yep.
I think the value of being assessed by a movement disorder specialist really is if there's some question about the diagnosis, although, as I mentioned 2 weeks ago, it's not always clear, even for a specialist, exactly what the diagnosis is, at least early on. And when things start to become more complicated, so especially if you're considering one of the advanced therapies like deep brain stimulation or duodopa, I think it's good to see a specialist before you proceed down that road. To get duodopa, you have to see a movement disorder specialist, or just if your condition is just very complicated. Lots of people have lots of non-motor symptoms, particularly if the motor symptoms are tricky to manage, then it's good to see a specialist. Otherwise, most general neurologists are pretty good at managing Parkinson's disease.
I think the next question is again about specialists. I would just add in, sort of, aside from sort of the doctors, is that I would say the sooner you access sort of a neurophysio, the better, in sort of getting onto sort of a good exercise sort of program routine, discussing things and sort of checking in periodically. So the next one I think will be for either of you two. It's hallucinations and delusions. Are they related to Parkinson's or to the levocarb meds? And excess sleepiness related to the actual disease or the meds?
I guess, Jonathan, I'll start a little bit with that one. So yeah, hallucinations, can occur in Parkinson's, kind of more in the advanced later stages of the disease. And this is due to changes in the actual brain. 20 to 30% probably, maybe. I don't want to give out a big, sometimes hard to say. Patients might experience some hallucinations or delusions. Now, the levodopa can make it worse in some cases. So if this were to happen, then, we might think about adjusting the levodopa dose a bit or using a medication to help with the hallucinations. Sometimes they're very mild, and so we don't have to even do anything about them unless they're very bothersome or frightening for that patient. Anything to add, Jonathan?
No, that's pretty good. Yeah, the answer is both, basically.
Yeah. And then excessive sleepiness, this kind of goes both ways. I guess if the patient isn't on a high enough dose or a good dose of the levodopa, sometimes, with that rigidity, the more difficulty with your movements can become, you can feel more fatigued that way. So some people interpret that kind of rigidity and stiffness as kind of fatigue that they're experiencing when they're exercising or doing activities. And then on the contrary, the levodopa can sometimes make people a little bit sleepy. So it's really individualized, and it's important to discuss that with your care team about, what exactly is the sleepiness that you're experiencing.
Mm-hmm. Yeah, there's lots of reasons why people with Parkinson's can have excess sleepiness. So lots of reasons why sleep is disrupted. So sometimes your medication might wear off and you start to have a tremor, or you get stiff, and that will wake you up. People often have to use the bathroom, sometimes multiple times per night, which can disrupt sleep. Insomnia on its own is common. People are more likely to have sleep apnea with Parkinson's disease. Restless leg syndrome, fatigue is a symptom of the disease itself. And then if you're really struggling to do things like get dressed and tie your shoes and have your shower, all that stuff takes more energy than it should. And so people will tire out more quickly. So there's lots of reasons why people are tired. And then, as Joanna mentioned, some of the medications definitely can cause sleepiness as a side effect, for sure.
So I think the next question is for areas without medical specialists for PD, North Vancouver Islanders, UBC, accept remote clients?
We do, yes, with a small asterisk in that generally speaking, we ask that people come to the clinic for an in-person assessment, often for the first visit, just so that we can make sure we're clear about what the diagnosis is. And then there are limits to what one can accomplish over telehealth as well. And so sometimes if people have unusual symptoms that it's not clear if they're related to Parkinson's or something different, then that might need an in-person exam. And so yes, we do, but there are times when we ask people to come into the office. And I think just in general, it's important to see your physician in person. For Parkinson's disease, I think every year or two, it's good to see somebody in person. There are a couple of movement disorder specialists on the island now, not on the North Island, but there is someone in Nanaimo now. who just relocated from the UK. So there are options as well.
And then the next question, I can start walking with no pain in my back, but after 30 minutes, the back becomes very sore. I tried to play 9 holes at golf, but often can only do 6 holes. So there could be many things related. So I think definitely if you haven't had any sort of investigations into sort of back pain, that would be my first sort of part to sort of discuss with your doctor and see if there's any sort of investigations to actually get a diagnosis if there's anything sort of happening in the back. The fact that it becomes sore after a certain amount of time, one of the things that sort of automatically highlights to me is maybe around your postural muscle control. And it's sort of maybe elements of that sort of those muscles can fatigue as much as sort of you work on your power muscles, sort of the postural muscles can fatigue. So it may be elements of that sort of they're fatiguing, and then you may be changing your alignment slightly, sort of maybe in your back, or maybe sort of with the way you're walking, maybe have some asymmetry, which is then have an effect on the back there. But again, that really would need to sort of have an assessment with someone in person. I don't know if anyone else has any comments about that.
No, I agree completely.
No. Any comments on stem cell treatment applied to Parkinson's?
Yes. So stem cells are being investigated as a restorative therapy for Parkinson's. So there's damage to the brain being done by Parkinson's, and populations of neurons are slowly dying away. And so there's a lot of interest in using stem cells or other treatments to regenerate those neurons that have died away. I would say that right now it's still very much experimental. There's been no data that show that they're safe or effective at this point. There are some concerns. One of the ways that stem cells would work is you want to get challenges, I guess, are getting them into the correct part of the brain where you want them to create the connections, getting them to turn into the right type of brain cell, getting them to make the correct connections again between the areas that have been disconnected, and then getting them to stop dividing. Because what stem cells do, they're a precursor to lots of different cells. So they would go in and they would divide, and then they would mature into neurons and take over the place of the cells that have degenerated. If they don't stop dividing, then that's cancer. That's what cancer is. And so there's a lot of very significant technical challenges associated with stem cells. So right now, I would not recommend going through with that unless it's part of a well-designed clinical trial. So I think it's still a little ways off, unfortunately, but it is something that has some promise in terms of reversing some of the changes that have happened.
And then we have, is Alzheimer's or other dementia more common in people diagnosed with Parkinson's disease?
So Alzheimer's and Parkinson's are separate diseases. There are unfortunately people who are unfortunate enough to be blessed with both, blessed with in inverted quotations. So yeah, it can happen that you have both Alzheimer's and Parkinson's disease. Dementia can be a feature of Parkinson's disease itself, however. So if you follow people with Parkinson's for long enough, the majority of people will actually develop some degree of cognitive impairment. So from data from Norway, I'm aware of, that had 20 years of follow-up, 80% of people after 20 years had some degree of cognitive impairment. And the best thing you can do to fend that off is to stay active. So physically active, socially active, and mentally active. And that helps reinforce the connections between the brain cells and protects them from degenerating, and can delay the onset of cognitive decline.
So I'm just going to jump down to the last question that's coming because it was related back to the stem cells. So the question was, does that apply to placental stem cells?
Yes, I would say all forms of stem cells right now, there are still some fairly significant potential safety concerns. And so I would be very cautious about it personally.
And we have, is BC planning to increase access to DBS?
So they say. So they have doubled the number of surgeries, so that has helped. And they had promised several years ago to hire a second surgeon. However, that has failed to materialize. I do know that the Parkinson Society is still advocating very strongly with the ministry to actually have that funding materialize. So hopefully the DBS surgeons aren't exactly super common either. So we're going to have to have funding for a second surgeon and then find somebody to bring to the province. So there are some challenges, but there is work afoot to have that to improve things.
And then is it possible to self-refer to a neurologist?
No, you do need a referral from a physician to see a neurologist. It can be a family doctor, a doctor at a walk-in clinic, but you cannot, in Canada, you can't see a specialist without a referral, unfortunately.
I think that's all the questions that I see, unless there are any more.
Michelle, I had
a hand up.
Oh,
okay.
Another hand up here. Brian?
Oh.
Or maybe he typed
we
it.
have actually 2 hands up.
Okay, I can't see that, I'm afraid, sorry.
So I'm just going to let them, I see 1 hand up now. So it's Brian. So Brian, you may ask your question if you unmute yourself. Brian, did you have a question?
Oh, it looked like he maybe typed it as well. That was the question about increasing access to DBS.
Okay. Michelle, I had a question actually. I often get the question from people asking if there are massage therapists who specialize in Parkinson's. And while, I usually tell them there are neuro physiotherapists, I'm not so sure if there are massage therapists that specialize in Parkinson's. Is that accurate?
That's correct. I'm not aware of anyone who has a sort of a specialization in treating clients with Parkinson's from a massage therapist. And I think massage therapy, I find, is very personal as to sort of what people like. I think, different therapists work in different ways, and different people like different aspects of how those therapists work. So I find it can sometimes sort of take, me personally, I think I've had maybe sort of 4 or 5 different massage therapists, and sort of to find my person that works for me and sort of what I like and what works for my body. And so, yeah, I mean, there are, as well as the registered massage therapists, there are student subsidized clinics, and they will run clinics specifically for people with neurological conditions. And they're based in the Lower Mainland, though unfortunately I don't know of any outside of that, but there could well be. There are 4 in Vancouver, I think 1 in Surrey, and there's possibly 1 in Victoria. So if you don't have extended health benefits, then they are subsidized at quite a reduced rate. So I want to say within the sort of the $20, $25 range compared to $125, which a regular RMT would cost.
Great, thank you.
Okay. So we have someone who is 84 and walks a lot, tends to falter left or right. How can I correct this? Sleep a lot, or fall asleep after taking my doses. So faltering left or right, I think it, again, would need a little bit more of an assessment of your balance and balance reactions to see if it's sort of more balanced, or if you have any particular weakness, either in sort of the legs or the torso, that may be leaning you towards that sort of lateral sway. But when you tend to have a little bit more of a lateral sway, that will be a little bit more reliant on sort of your balance mechanisms there. But I would definitely encourage you to seek an assessment for that.
And with regard to the fatigue, I might just add that, sometimes fatigue can obviously occur in people without Parkinson's. So, getting a good workup with your family doctor or nurse practitioner as well, just to rule out anything else that might be contributing to fatigue. But also with the levodopa, you know, sometimes what we see is that blood pressure can drop a little bit too with levodopa. And so just making sure that your blood pressure isn't too low, and maybe that's why you're feeling, you know, tired or lightheaded, or you know, you feel like you need to sit down. And then there's also a connection between, you know, fatigue and mood as well. And so, you know, if there's any underlying depression or anxiety, or, you know, you're sleeping 8 to 10 hours a night, but are you having good quality sleep, or are you waking up, you know, multiple times per night for various reasons? Are you napping during the day? You know, staying active during the day with scheduled activities, and, you know, getting outside of the house and getting some fresh air, and these sorts of things that can help with fatigue management.
The other thing is, if you're not using a walking aid, it may be that you need to consider something. Or if you are using a walking aid, then what you might be using might not give enough stability. So again, sort of to address from that side of things. Next one we have is excessive sweating, and is there a particular odor to Parkinson's sweat?
So I can take that one. So excessive sweating is very common, and it's a very common wearing off symptom, actually. It doesn't hurt if you're just excessively sweaty like all the time. It doesn't hurt to, you know, see your family doctor and make sure you don't have a thyroid problem or some other medical thing contributing to it. But if it happens sort of when medications are due, it's a very common non-motor wearing off symptom. So that can be addressed just the way you would manage your wearing off. In terms of the odor of Parkinson's sweat, I don't think in a day-to-day manner there would be much difference. However, there is this woman in Scotland who apparently can reliably smell people with Parkinson's, and they have trained dogs actually to smell out people with Parkinson's. So there presumably, based on these things, is a difference in the body odor of people with Parkinson's. And I think there is some work trying to use that as a sort of biomarker to be able to better diagnose Parkinson's disease. But for now, it remains sort of I guess, an interesting factoid.
And the next one, we have advice on whether to start PD meds if my symptoms are tolerable without them.
Yeah, so we kind of went over this a bit last week. And again, it's really individualized based on how how anyone's symptoms are affecting their daily activities and, you know, their job or their daily tasks. And so if someone, you know, feels like they're managing okay without using any medication, then, you know, that's the patient's decision, and that's fine. The levodopa doesn't, what we understand now is that levodopa doesn't slow the progression of the disease, but we use, you know, medications such as levodopa to help with people's movements. And so, you know, we want people to be active and carrying on with their daily activities. And so the medications can help with that. But if somebody, you know, wants to go on a strict exercise regime and, you know, do that as kind of their management for Parkinson's initially, then, you know, that's fine too. Anything to add there, Jonathan?
Yeah, I mean, the way that I approach this is basically the treatments for Parkinson's are all about improving your quality of life, right? And taking medications has often a negative impact on one's quality of life. And so it's finding that balance between the two that's going to sort of optimize the way that you're feeling in the day. So at the end of the day, the point of the treatment, like Joanna said, is so that you're able to do the things that you want to do and live as normal a life as possible for as long as possible. And we generally don't perceive any benefit anymore to waiting. We used to, I mean, you know, 15 years ago or less, we used to suggest people try to stay off medication as long as possible because you had to save it for later. And with better data and just more experience, we know that there's really not much advantage to waiting. And so it really is just about finding that balance. But you don't want to wait so long to go on medication that you're struggling through your day. And then when you start the medication, you're already having trouble with fluctuations and dyskinesias and all that sort of thing, because that can happen if you delay.
We've had someone letting us know that they had good success with Rolfin for Parkinson's symptoms. I hadn't heard of this. I've just looked it up. So Rolfin I have here is a structural integration, a form of bodywork that reorganizes connective tissues. Alternative medicine originally developed by Ida Rolf for structural integration. So I'm always interested to learn about different things that people have tried and had success with. I have clients that will use Feldenkrais as well. But yeah, good. It's always good to share these things. Someone has said they've been taking MSM joint formula for joint. I have a history of frozen shoulders. Does MSM benefit PD?
So right now, unfortunately, there's no supplement that's really been consistently demonstrated to have benefit for Parkinson's disease. I'm not sure about, I know people take various things like glucosamine and chondroitin and whatnot for their joints. I don't know what the current state of the art around that is, but probably it's not going to cause any harm either. Frozen shoulder is very common with Parkinson's disease as well, and often related to reduced arm swing when you're walking. And then if you're not moving your arm when you walk, then your shoulder, you can get a frozen shoulder. So that's another thing, just to, see a physiotherapist and see your doctor and see if there's any treatments that might be of benefit in that regard.
And then we have someone's on an antidepressant but still finds that depression is severe some days along with fatigue, connecting with a counsellor later this week to set up appointments and trying to keep contact with family and friends ongoing. Any other suggestions?
Any other suggestions? I mean, yeah, depression can be really common in Parkinson's, and I think you're doing all the right things. Sometimes, depending on how long someone's been on the antidepressant for, if they're just started on something, then, sometimes it does take a little while to really find that it's effective, like 6 to 8 weeks or so. And then sometimes people have been on it for a really long time and they haven't noticed any improvement. Then it's important to discuss that with your doctor and, maybe trying another medication that might be kind of more energizing that you can take kind of in the morning time. Talk therapy. So we talked about last week about psychotherapy, connecting with a counselor, connecting with, the Parkinson Society would be great. Whether or not someone would be interested in a support group. And then cognitive behavioral therapy. There's also evidence to suggest that can be really beneficial for people with depression and anxiety. And exercise, these things as well can have an effect.
And when mood is really severe, it might be time for a referral to a psychiatrist as well. That can be sometimes quite helpful.
I'm just going to jump to the last question because it was asking how much longer is the discussion last, and I think we have until 11:50 is my understanding. So a few more minutes. We have a few more questions. So the next one is, should I be treating neck pain with meds?
I think that's another thing that would probably need a bit more of an assessment, just to get to the bottom of what the neck pain is. I mean, having said that, there's nothing wrong with Advil or Tylenol for some neck pain, but it doesn't hurt just to, if it's really severe and persistent, then it doesn't hurt to have it assessed to make sure there's nothing more serious.
And then we have, do you have any experience with individuals not using drugs to manage Parkinson's symptoms?
Yes, I mean, lots of our patients, especially with early Parkinson's, choose to defer medications. There does come a point when everybody with Parkinson's will need to go on medication. Things can become, life-threatening just in terms of inability to swallow, poor balance, ability to function. So exercise is very helpful, but will only take one so far. And at some point, with Parkinson's, there's a very significant deficiency of a neurotransmitter in the brain, and the brain just will not function without some level of that chemical dopamine. And so at some point, medications do become fairly necessary.
Then we have, how common is sexual dysfunction with Parkinson's, and is there any alternative to Viagra?
Very common and not asked about nearly often enough. And again, there are many reasons why people can have sexual dysfunction. So there are physical changes with Parkinson's that affect the part of the nervous system that, for both men and women, that are involved in sexual function. However, there can be lots of other things as well. So there's a lot of psychology wrapped up in sexual function as well. And when you have a chronic illness like Parkinson's disease, it can affect your self-esteem. There can be issues with pain. There can be lots of other issues. And sometimes talking with somebody who's familiar, like there's a sexual health clinic, for example, at Vancouver General Hospital that we often send our patients to that can be quite helpful, that's nursing led. And you also want to make sure that there's not another medical thing contributing. So there is, like with many other things, a tendency just to blame everything on Parkinson's disease, but you don't want to miss the thyroid problem that's messing up your sexual function, for example. And then there are Viagra and the other medications in that class are all reasonable options for erectile dysfunction. And then if Viagra is not effective, there are some more invasive interventions as well for erectile function.
Is there any research that acupuncture can assist with symptoms?
There is, and it does, but only very transiently. So people feel better after acupuncture, but it's not a durable benefit based on the studies that I'm familiar with.
Any experience with photobiomodulation?
I assume that this is talking about some of the studies that they've done recently looking at light stimulation sometimes through the nose, I think. So I think that would still be considered an experimental treatment, but stay tuned. Lots in the pipeline.
And then does alcohol negatively affect PD?
Not directly, but everything in moderation. Obviously, if you have issues with your balance and then become intoxicated, that's not going to help your balance. Probably excessive alcohol consumption is not good for the nervous system in general, and alcohol can be toxic to the nervous system when used in excess, and it can cause damage to the peripheral nerves and give you numbness and tingling in your feet. It can cause degeneration of the cerebellum, which is the balance center of the brain. If you have, 1, maybe 2 drinks a day or less, that's probably okay. At the end of the day, nobody really knows what the safe consumption of alcohol is. And you do have to be a bit mindful about interaction with any medications you're taking as well, especially if you're on any medications that are sedating. Alcohol is a suppressant of brain function, and so things can become synergistic, especially things like sleeping pills and some mood medications as well.
Do you have any experience or knowledge about the studies in focused ultrasound?
So right now, focused ultrasound, what that is if we rewind to before there was deep brain stimulation, the surgical treatment of choice was a sort of stereotactic treatment where they would put a wire into the brain and use electricity to burn a hole in the brain, take the wire out, and something about that hole disrupted some kind of abnormal circuit that made the symptoms better. So then deep brain stimulation came along, which is adjustable, and supplanted that old technology. And now what they've done is gone sort of circled back, but instead of using electricity, they're using ultrasound, which is sound waves, and they're using basically sound waves and ultrasound to generate heat deep in the brain. It's a little bit like how radiation therapy works on a cancer. You beam the ultrasound from all around, and it converges at a point, and the sound generates heat and burns a hole in the brain. So right now it's being used as a treatment for tremor. I think mainly for people who either don't want or aren't candidates for deep brain stimulation for various reasons. And it can be used to treat Parkinson's as well, in the same way that the old-fashioned stereotactic, pallidotomy or subthalamotomy would have been done. Having said that, it is a one and done procedure. You can't adjust it like deep brain stimulation. I think for Parkinson's, it would still be considered experimental. The only place that they will do it in Canada is in Toronto. It's only actually offered in Toronto and Calgary right now, and Calgary is not taking any patients from out of Alberta for any reason, and B, only doing it for tremor. It's also being used as a way to open up the blood-brain barrier in order to administer drug therapy. So there's different applications for focused ultrasound. So I'm not sure exactly what angle that you were wondering about, but it is being used.
And then someone just asked about the slides, and I think Alana did reply, but only replied to, I'm not sure if everyone can see it. So you said that it will take 1 week to process the recording, and then the slides will be posted on the website. I don't think there's any more questions.
Jonathan, I had a question. I thought I came across some research that said that people who are diagnosed with tremor dominant Parkinson's are more likely in their disease progression to have dementia. I'm wondering if you could comment on that.
My understanding is it's the opposite, actually. People with tremor dominant are
okay.
less likely to develop dementia, and in general also tend to have a slower rate of progression. Probably at the end of the day, Parkinson's is more than one disease. It's probably a more of a syndrome or a family of diseases, which might explain why people have such different symptoms and why people progress at such different rates. So there's a lot of research going on right now as well, trying to subtype people and figure out, like, you have Parkinson's type 1A, or, I don't know what the names that they're coming up with are, but trying to split people apart into hopefully more homogeneous groups of people, which would help identify treatments. Because if you're looking at 30 different diseases, it's unlikely that all 30 of those diseases will have the same cure. And so if you're just taking a group of people with Parkinson's disease and trying a treatment on them, you may miss a cure for a subtype of Parkinson's because you've lost the signal for the noise. So they're doing this now with the genetic types of Parkinson's, for example. So they're taking people with GBA mutations or LRRK2 mutations and coming up with therapies that should reverse whatever problem those mutations cause, and seeing if that will slow disease progression. So it's looking in that area of personalized medicine. But I think that's probably one of the reasons why there's such variability between people with PD.
Okay, one more question. I also often get the question about Botox injections. So I'm wondering if you could comment on in what context might someone with Parkinson's have Botox injections? And also there seems to be some confusion as to whether it is covered. Medical coverage.
Yeah, good question. So Botox, just for background for people, is a medication. So there's 3 different brands we have in Canada. There's Botox, Xeomin, and Dysport, which are all roughly the same thing. They work by weakening muscles. It's the same stuff people use for their wrinkles, but before it was used for cosmetic purposes, it was actually used for non-cosmetic purposes. The main utility for Parkinson's disease is either drooling. It's Botox into the salivary glands actually can dry up the mouth a little bit and help with drooling. And the other thing people use it for is if they have dystonia. So not uncommonly, when people, often as medications are wearing off, what will happen is your toes will want to curl. Sometimes the big toe comes up and the foot wants to sort of turn in like this. Usually I approach that by trying to adjust medications and just prevent the wearing off. But if you have refractory dystonia that's interfering with your gait or causing pain, you can actually put Botox into the muscles that make your foot do that. And that will reduce those symptoms temporarily. It lasts around 3 months, sometimes a bit longer for Parkinson's. And the goal of it being that you put enough in to prevent the excessive movement while not putting so much in that you lose voluntary control and end up with a floppy foot, basically. So unfortunately, for the indications that we use it for Parkinson's disease, it is not covered by pharmacare. So it's not covered for limb dystonia and it's not covered for drooling. Some physicians have agreements with pharmacare whereby they don't have to apply for coverage, and if they write a prescription, it's automatically covered. But having said that, if they were ever to get audited by pharmacare, they would be in a world of trouble. So yeah, unfortunately, it's not actually a pharmacare benefit. The limb dystonia, it's an off-label indication, so it's not Health Canada approved for that. It is the standard of care around the world for limb dystonia of any description. Botulinum toxin injections are the standard of care. So, but it's not covered by pharmacare. Yeah.
Okay, thank you. I believe that was the last question coming from me. I don't see any other in the chat box. So I would like to thank all 3 of you, Michelle, Jonathan, and Joanna. Thank you so much for sharing your expertise and knowledge. And we look forward to having you back with us next year again. to do the workshop with us again. And again, thank you all for attending. And as mentioned, we have recorded these talks, all 3 of the talks in the series, and they will be posted on our website, and so will the presentation slides. And if you ever have any difficulty finding the slides, feel free to email me. You can find my email address on our website, and I can send you the link, no problem. Thanks very much, everyone. Bye now.
Bye.
Bye.